lower deep core progression, specifically targeted to work your transversus abdominis, which is your deepest abdominal tissue that wraps around and kind of creates an internal back brace around you. It inserts all the way into the thoracolumbar fascia, which helps stabilize the lumbar spine. So this is amazing for pregnancy, early postpartum. Depending on what you have going on, please see a pelvic floor PT before you just start exercising. But this is a great thing to do during pregnancy, or even if you're just having trouble accessing these deep muscles here. So you're going to start on all fours, making sure the heels of your hands are directly under your shoulders. Sometimes I like to bring the big middle fingers together and then bring them apart to really measure where we are in space. Our knees are directly under our hip sockets, pressing the floor away and lengthening through your toes. And then I want you to start here always with these keyhole arm, putting the key in the lock and rotating it is kind of what that should feel like. Should feel the upper arm bones rotating to kind of feel if your rotator cuff is internally or externally rotated. And we want to stop an external rotation, which means your elbow creases are in line with your index fingers and your elbows are pointed inward toward your knees. You're going to push the back of your head toward the ceiling. Take a few deep umbrella breaths, 360 degrees all around as you inhale and exhale. Inhale. Really feeling the back body back here expanding into those back ribs. Now, you're going to start to do belly drops, is what this is called. You're going to inhale and just let your belly go, let your belly drop. If you're pregnant, you're going to think of your baby dropping down, but without letting go of your lumbar spine. If your low back is dropping, then you're not doing it correctly, and your lumbar muscles are going to be overactive, which they already are in pregnancy. So let's try to stretch those out by lengthening through the lower back. Just let your belly muscles release on the inhale breath, and then on the exhale breath, pull your belly up and in, or pull the baby up and into your spinal column. Inhale, let it go. You might feel your pelvic floor relaxing as well. Exhale, pull the belly up and in. We're going to take 8 more of those. Inhale, let the belly go. Exhale, pull the belly back up and in. Inhaling, let it go. Exhale, pull the belly back up and in. Inhale to let it go. Exhale, pull the belly back up in. Inhale, I call these your zipper muscles, right where you would suck in to zip up a tight pair of jeans. Just really expanding the belly on the inhale. We have to be able to relax a muscle in order to properly shorten it or tighten it. So if our muscles can't let go and relax, we're not really able to access them properly. Inhale and relaxing the belly down. Exhaling to pull it back up and in. Then we're going to curl the toes under and do the same thing with a little bit of a bear hover. So take a breath in, letting the belly drop down, and then exhale, push the mat away as you zip up through those lower muscles down here, and then lift the knees off the mat. That's all on an exhale breath, and then inhale to place the knees back down. Take a breath in. Exhale, belly pulls up and in to lift the knees off the mat. Hold for an inhale breath. Exhale, lower. Breathe in, belly relaxes. Pelvic floor relaxes. Exhale, zip up through the low belly. You'll feel the pelvic floor turn on as you hover. Inhale, hold it. Exhale, release it down. Take a breath in, pushing that mat away. The longer you do this isometric holding, the more strain you're going to feel in that shoulder girdle, and it's strengthening you. You'll be able to plank and have a strong upper body. Exhaling to lift, 2, hold, and release down. Inhale, release the belly. Exhale, pull it back up and in as you lift the knees off the mat. Hold, inhale. Exhale and release down. Take a breath in. Exhale, lift. Really pressing the back of the head towards the sky. Inhale. Exhale. exhale down, inhale, exhale, keeping those elbows rotated in. It's a lot of shoulder work here, and release down. I'm going to give you a moment to sit back on your heels, kind of coming out of that. If you're doing it properly, you should feel the burn through your shoulder girdle, maybe a little strain in the wrist. Stretch it out. And then we're going to come forward onto the hands again. And let's try some scapula glides here. So with the knees down, again, the hands under the shoulders. You're going to rotate your elbows inward, just like your keyhole exercise. And then with maintaining your neutral spine, you're going to lower your chest, allow your shoulder blades to come together on your back, and then bring them apart and wide on your back. So they come together on your back, and then wide on your back. Together, wide. 4, 5. And notice how I'm keeping my elbows really stacked and straight. I'm not unrotating them as I go down, which is easy to do, or bending them instead of to bring yourself down, rather than just letting your chest lower within the range that you have. It's not a huge movement. This is a less is more movement. Less movement is more effective here. But we really want to see how much motion we can get out of the scapula, differentiating it from the elbow. Good, one more, and then push away from the mat, maintaining that scapular width on your back. We're not protracted and rounded in the spine. I want to make sure that you maintain your neutral spine, lengthening through the crown of your head, lengthening through the tip of your tail. Let's take a couple more umbrella breaths there. And then we're going to curl the toes under. Exhale to hover, zipper through the belly, and hover your knees off the mat. Take your scapula glides here, down, up. It's going to be even smaller movement with the hover. 3, 4, keep zipping through that low belly. Keep lengthening through the crown of your head and your tailbone. Maintaining the neutral spine. 3 more. 2, 1. And just lower the knees down. Sit back, bring your knees wide. You can take that wide knee child's pose. Really let your belly go. Really let your lower back stretch. And feel your pelvic floor really relaxing here. You can bring something under your head, like your arms. And just really bring your breath down into the pelvis, down into the perineum, between your sitting bones, pubic bone and tailbone. How much can you expand on that inhale breath? As you expand down into the pelvis, can you expand back into the back side of the posterior rib cage? Take 3 more breaths there. Breathing is your best friend during pregnancy and early postpartum. It's the most important thing that we can do for our body to maintain that 360-degree motion of the rib cage and the diaphragm, to stay connected to our pelvic floor. Let's just come back onto all 4s and do a quick spinal mobility moment here with some cat-cow, looking up, down. Really trying to think about moving from the distal ends of the spine, which means the tip of the head and the tip of the tail. Initiate and direct your movement. This just gives you some mobility after all that stability work, which is beautiful work, but you just want to make sure that you can move through your fullest range. 2 more times. Inhaling to arch the spine, stretch the belly. Exhaling, pull the belly up and in as you tilt your head and tailbone down toward the mat. And then 1 more time up, stretch that belly. And then just stop in neutral. And let's bring your left leg out to the side. Your foot comes flat. We're going to do a little bit of variation on thread the needle here. You're going to push away from the mat, reaching up, and then reaching under. Reaching up, and reaching under. 2 more times. I'm allowing my inner thigh to stretch on that left leg. The fascia that covers our inner thigh connects up into our pelvic floor. So it's really important to get an inner thigh stretch. So keep that foot there. Bring the opposite hand behind your head, and you're going to lift the elbow up toward the ceiling. This will be hard. It will feel really hard to move, and that's okay. You're just taking yourself to your boundaries, finding your edge. Take your eyes where your elbow goes, lifting the elbow up, and then elbow to elbow. Lifting it up, and elbow to elbow. And then just bring that hand back down under the shoulder, and the knee comes in. Take it on the other side. The foot goes flat. You're going to lift this right hand up to the ceiling. So same arm as leg first. Doing your best to maintain the external rotation of this shoulder, this standing arm shoulder. And this first one is just nice. You get a lot of mobility here. So you can really focus on that inner thigh stretch of the leg that's straight out by kind of leaning down. When you go rotate down, kind of lean into it a little bit. Allow that inner thigh stretch to happen. It's nice to have a closed chain stretch there with your foot attached to the ground. Just bring that hand back down. Keep the same leg. Bring the left hand behind your head. Press the back of your head into your hand. Lift that same elbow up to the ceiling. Look up at it. And then elbow to elbow. And look up at the left elbow. I'm pushing away from the floor. Pushing away from the mat. Make sure you're breathing. It doesn't necessarily matter where the inhale and exhale are here, but just make sure you try to stay steady in your breath. It's easy to start holding our breath when we feel tightness through our thoracic spine. It sends us into a sympathetic state. So that's where our sympathetic nerves live. Good. And then just bring that hand down, bring the knee in, and sit back.